Hello, hello. So we had the influence diagram for our friend who has cancer, and we will help him to choose the treatment between three options. Our options is here. So he will decide when we solve the decision influence diagram, and he will choose the optimum decision with maximum utility. But to do that, we need to add CPTs and utility values into the model. For now, it has only qualitative parts, which shows the dependencies and interaction of the nodes. But we need to put some numbers, CPTs, probabilities, conditional probability tables, and utility values, which express our preferences. Okay. So in this video, we will continue to add CPTs, CPT, conditional probability tables for the nodes, general health. Since general health doesn't have any parent, we will just put the probability for three states here. And we will add conditional probability table for treatment duration, which has one parent, direct parent treatment. And we have side effects, another chance node. We will add CPTs for this chance node. And in the upcoming video, we will talk about the utility values. And when we have those two component, we can use the model to infer, to get the optimum decision. And finally, after two videos, we can help our friend to choose. So let's continue with CPTs. So to do that, we can again use our model, and we will use a predefined function or method, CPT. And let's start with general health. We will fill probability into the model. Fill with, so the probability for the states would be this, of course, needs to be based on the data. Okay, this is the probabilities of the states for general health. Let's continue with the side effects. Okay, I will copy this part. We will do it for side effects. Sorry. In this time, since we will use the conditional probability table, we will conditioned on treatment because it's the parent of side effects. So in this case, we will write conditional probability for each state of decision node because decision node is the parent. So how we can do this? Here and curly brackets. Oh, curly brackets, and we will write the probabilities. Okay, in here we will write the parent, in our case treatment, and we will condition on one state of it. Okay, so our parent is treatment, and the first state is surgery. So when the treatment is surgery, what is the probability of having side effects, having mild side effect? Let's say 0.3, having moderate side effects. Let's say having poor, having severe side effects is 0.5. As you know, the probability, the sum of probabilities should be 1. Yes, it's correct. So let's continue with the other states of decision note. Okay, what is the probability of having mild side effects when the treatment is chemotherapy? So we conditioned on treatment. Let's change the probability just to have some difference in between, because we don't have data for this, so I'm just making up. Okay, let's just run whether we have error. Okay, no errors. So far, so good. We will do this the same thing for treatment duration. Treatment duration is here. Let's say when the treatment, so because it's the same parent, treatment duration has treatment node as a parent. So when the treatment is surgery, what is the probability of having long treatment? Long treatment here. So we can just change it like this. And we can continue to add the rest. But just we need to focus that the sum of probabilities should be 1. Let's run it whether okay, no error. Okay, so we can close that video since we have the CPTs. But before we close the video, let's check our CPTs. Let's see them in the output. So to do that, we can there might be more options, but since this is a object-oriented program, we can print whatever node we want. We can print the CPTs of, let's say, side effect. Let's just write the, let's say, node name. Node name is side effects, and let's use another name node. This is our model, and node name. Let's run whether to see we have error. No error, so good. So let's print node. Wow, that's great, right? When the treatment is surgery, having mild side effects is 0.3. When the treatment is chemotherapy, having severe side effects is 0.7. When the treatment is radiotherapy, having mild side effects is 0.6. In this case, chemotherapy has severe side effects and surgery has mild side effects, we can say that. Okay, so we can close the video. We will continue to add utility nodes, utility values in the next videos. So see you soon.